Good afternoon, everyone. I request to all the learners, please kindly turn on your camera, okay, so we can make this session more interactive and impactful also. Okay, so good afternoon, everyone. Again, it gives me a great pleasure to welcome you all for today's Global Health Dialogue Session 3, organized exclusively for our medical imaging technology students in academic collaboration with TORG, the Operating Room Global. We are deeply honored to partner with TORG, an international healthcare education and quality improvement organization dedicated to strengthening clinical standards, patient safety practices, and professional excellence across the healthcare sector. Today, we are privileged to have with us an eminent healthcare professional, Dr. Ishaan Bakshi. Dr. Bakshi holds an MBBS degree along with an MBA in healthcare management, combining strong clinical knowledge with healthcare leadership expertise. He is currently an registered ITI trainee at the Royal College of Radiologists, London, one of the world's most respected professional bodies in radiology. He also served as the Director, Quality and Performance Monitoring at the Operating Room Global, TORG, where he actively contributes to advancing healthcare quality frameworks, clinical governance system, and performance monitoring standards internationally. With his experience in clinical quality assurance and international radiographic standards, Dr. Bakshi brings valuable insights into today's topic. And we all know today's topic we are going to discuss is professional standards in clinical radiographic positioning, accuracy, safety, and image evaluation. Before we proceed, I would also like to express our sincere gratitude to the CEO of Operating Room Global, TORG, for supporting this academic collaboration and for extending this valuable learning opportunity to our students. Such initiatives truly bridge the gap between classroom education and global clinical standard. On behalf of our institute, Emversity, our faculty members and students, I extend a warm welcome to you, Dr. Bakshi. Thank you, sir, for joining us. Sir, the platform is now yours.
Thank you so much, Mr. Vicky, for such a nice introduction. Good afternoon, everybody. Myself, Dr. Ishaan, and we'll be talking a bit today about radiographic positioning, accuracy, safety, and image evaluation would be the key components of today's presentation. I'll try to keep it as interactive as possible. So I would really appreciate active participation from everybody over here. So we're going to start. Okay. First of all, let's talk a bit about the background, right? So what is radiographic positioning and why is it important, right? So as all of us know that radiology and radiographic examination is basically the first and most commonly performed procedure in the clinical practice, right? So almost in every hospital, in every healthcare setting, especially in emergency, the imaging services serve as an initial diagnostic tool. So whenever we see a patient, whenever a patient describes their symptoms to us, so the first thing we're gonna tell him is, okay, you go get an X-ray done, or you go get an MRI done, or you go get a few tests done, so that it's easier for us to evaluate what's going on, what wrong is going on with the patient, right? So the quality of that particular image depends on the patient's position and proper technical execution. So if the patient is not aligned properly, the patient is not positioned properly, the image won't be good. So, and we won't be able to evaluate and interpret the image properly, right? Even with advanced digital imaging systems, still positioning is really important, because poor positioning, softwares, AIs, they can't help with poor positioning. So patient position is really important for us, right? So if we get a poor position, the image would be poor, which may lead to misinterpretation, delayed diagnosis, incomplete visualization of anatomical structures. And it increases the risk of repeated examinations, resulting in unnecessary radiation exposures, right? So, that is why radiographic positioning is really important. And it is basically the foundation for accurate diagnosis and effective patient management. So, what is the need of professional standards? So, we need some professional standards and some kind of Vicky, can you see my screen? Is it visible?
No, Dr. Ishaan, as of now, we are not able
Oh,
to see the screen.
maybe just a second. Is it visible now?
Yes, yes, now it's visible.
Perfect, perfect, perfect. Okay. Okay. So, okay. So what is the need of professional standards? So we need certain guidelines and certain protocols in place so that, regardless of the hospital, regardless of who is operating the machines, we get the uniform and high quality image every time. Right? So without these standardized procedures and protocols, there may be variations which may lead to inconsistencies in image quality, hence lead to unreliable diagnosis. So the standards also helps us in minimizing errors related to position, exposure, and patient handling. It promotes accountability, transparency, and ethical practice among radiographers. And in addition to all that, if there are standards, there's some sort of legal protection for healthcare professionals and institutions. So yeah, overall, there are many benefits, and that's why we have certain standards in place. So now that we have talked a bit about background, let's dive a little bit deeper in what we're going to talk about today. So today we're going to discuss a little bit about some fundamental principles of positioning. We're going to talk a bit about radiation safety measures to protect patients and staff. We're going to evaluate a few images systematically, and we're going to see whether those images are of good quality or not. And towards the end of the presentation, we're gonna, briefly and quickly talk a little bit about documentation and ethical and legal aspects of imaging. Okay. So let's get started. So, firstly, okay, I have a question for you all. What do you think is the role of a radiographer in healthcare? Anyone?
Um, Educators, please unmute the mic and let the learner speak.
Okay, to diagnose patient properly and safely. Okay, anyone else? Anything else somebody wants to add? Maintain patient privacy. Okay, that's nice. Anything else? Maintain proper patient. Perfect. Okay. Thank you so much, guys. Okay. So radiographers, they basically play a very central and important role in healthcare system. Okay. So they are mainly responsible for performing the imaging examinations accurately, efficiently, to give proper image of patient anatomy to get better. That's good. Thank you so much. Okay. So radiographers, they ensure that the patient is positioned correctly, the patient is comfortable, and the image is of proper standards, which is readable and interpretable by the clinician to get to the diagnosis. Right? So apart from all that, radiographers are also responsible to operate and maintain the equipment and to ensure that their equipment is functioning properly and is of certain standard. and if there is any fault with the equipment, they should, get it fixed. It's their job to maintain their equipment. Um, and we really expect a sense of professionalism, empathy, technical competence from radiographers, so that at the end it's all about the patient, right? So if they are doing their job well, we'll be able to do our job well. Yeah. So let's dive a bit into the accuracy part. Okay. So what do we mean by accuracy here? Anybody? What do you guys think we mean by accuracy in radiographic positioning? Yes, please.
Good afternoon, sir. My name is Pragati. So,
Hi.
accuracy in radiographic positioning means precise positioning of patient while we are doing imaging.
Okay, perfect, perfect. Very nice. Thank you. Anybody else? It means the perfect position also can be aligned so that we can diagnose accordingly. Okay, perfect. Thank you so much, guys, for your answers. Okay, so accuracy, basically what accuracy is, that the image at the end represents a patient's anatomy properly without any distortion or disalignment, right? So basically, for example, if the clinician wants that, if the clinician thinks that this person has something wrong in the left lung and he requests for a chest x-ray, so the clinician would expect that the left lung along with the right lung should be accurately positioned, and the image should be clear so that it can interpret it properly, right? So it involves precise placement of the patient, correct alignment of the body part, and proper direction of the X-ray beam, right? So it ensures that the region of clinical interest is clearly visible and properly centered. Okay. So why accuracy is important, right? So it minimizes the chance of anatomical overlap, magnification, and rotation. So incorrect position may result in misleading images, diagnostic confusions, and unnecessary repeat examinations. So, for example, if the patient is not properly positioned, if he's tilted a little bit towards the left or a little bit towards the right, so we can have a few bones overlapping, which would lead to a wrong image, I would say, and which may then lead to improper or wrong diagnosis. So accuracy is a foundation, a cornerstone of a high quality radiographic practice. Right. So now that we know why accuracy is important, we have discussed a bit about that. So again, let's emphasize on the part that accurate positioning is important, and it reduces the need of repeated examinations. So for example, like, okay, if I'm a clinician, I receive an X-ray which is not proper, so obviously I request for another X-ray, right? So repeat examinations, they increase the radiation exposure to the patient. We are going to talk about radiation exposure in a bit in detail, but for now, it's important that we need to minimize the radiation exposure to the patient to as low as possible. So for that, accuracy is really important. It also saves time, and it also saves money, because if we are accurate for the first time, we will not need repeat examinations. High levels of accuracy enhances patient confidence and trust, and it also strengthens professional credibility and the reputation of your institution, right? Okay, so now that we have completed the accuracy part, let's talk about preparing the patient. Okay. So proper preparedness is first and most important step. So what we want is the patient should be comfortable. He should be in the right position. He should not be anxious, because if the patient is anxious, he'll move and we won't get a good quality image, right? So before starting the procedure, the radiographer must verify the patient's identity, because we have seen cases that the wrong patient has been given X-rays and the wrong reports has been done, and a lot of confusion has been there. So yeah, first and foremost thing should be the patient's identity should be verified. Okay. Second thing, the procedure should be explained to the patient in simple language so that the patient is not anxious. And when we explain it to the patient's fear goes down because he knows what's coming. So it is really important. Okay. All metallic objects, jewelries should be removed to prevent artifacts. As we can see, piercings, they're not good for X-rays. You're not able to get a good image if there are many piercings. Okay, the patient should be provided with appropriate hospital clothing to ensure privacy and comfort. The radiographers should assess the patient's physical condition, mobility, pain level, and ability to cooperate. And the radiographer should, go through the clinical history and previous imaging record should be reviewed so that the positioning is correct and radiographer knows what exactly the point of interest is in this patient. Okay. Okay. So I told you a bit about patient communication. So now I want to ask you guys again, why do you think patient communication is important? A few points I told you guys, something you want to add in that? It builds trust with the patient. Okay, perfect. Anything else? Easy cooperation to feel them good. Okay, okay. To make it understandable, to get more clarity about patient condition. Okay. Anyone else? Okay.
Good afternoon, sir.
Good afternoon.
Sir, communication is important for patient comfortability and avoiding the misdiagnosis.
Okay, perfect. Thank you so much. Okay. So yes, I guess all of you were right and you covered everything needed. So patient should be explained everything properly in simple language so that he fears less. Okay. So they should be informed about things they need to do, like bed holding, their posture, and we need to tell them that okay, you please don't move much so that image is not distorted. Okay. They should encourage patients to express discomfort if they're so. Okay. As a radiographer, should ask them, okay, are you comfortable in this particular position or not? So what happens is when you communicate with the patient, it develops trust and reduces anxiety, okay, which at the end helps in your image quality. Right? Okay. Now we're going to talk about body alignment. Okay. So why body alignment is important, right? Body alignment is important so that the image we obtain is distortion free. Okay. So how should body be aligned? So as you can see in this image, we are taking a skull X-ray over here, right? So the body part which has to be examined, it should be placed parallel to the image receptor. As we can see, okay, the skull is parallel to the image receptor. Okay, we can see the midline of the body is aligned to the central axis of the detector over here, right? And both sides of the body should be positioned symmetrically toward any kind of rotation. Right? Okay. Now the natural curves of the body should be supported with sponges and cushions. We're going to talk about cushions and sponges in a little detail later. right? The patient should be positioned in comfortable and stable posture to prevent any kind of movement. Okay, so improper alignment may lead to short foreshortening, elongation, and overlapping of anatomical structures. I'm going to tell you guys about it with example in a bit. And maintaining correct alignment improves image accuracy and reproducibility. Okay. So, okay, now we align the patient properly. We explain the patient what has to be done. We align the patient properly. Now we need to make sure that our source, our equipment is aligned properly. So the central ray and beam geometry, right? So the central ray, what is central ray? Central ray is the most intense part of the X-ray, okay, which has to be in the center of our point of interest, right? So proper alignment of the ray ensures accurate representation of anatomical structures, right? So the ray should be properly aligned in a particular angle. It should not be tilted, because if the ray is tilted, we can get magnified image, distorted image, or may also lead to anatomical cutoff. For example, let's say you guys are taking an image of your friend or somebody. You have your camera like this, right? So if your camera is properly centered when you of your subject, the picture would be good. If your camera is tilted like this, your subject will look smaller. And if your camera is tilted like this, it will look longer. Camera is tilted like this, the subject on this side would be longer, this side would be shorter, and vice versa. So correct positioning of your source and your subject is important to get a good quality image with accurate representation of the anatomy. Okay, so how do we make out what is the accurate anatomy and what particular part we need to focus on? So for that, there are a few anatomical landmarks which we use. So these landmarks help the radiographer to locate the region of interest without unnecessary trial and errors. Okay. So proper identification of landmarks reduces risk of incorrect centering and anatomical cutoff. So most commonly we use landmarks which are, for example, we use bony prominences, we use palpable joints and reference lines. So examples of this, for example, if you want to do an abdominal, imaging, we'll use iliac crest as a landmark. If you're doing a skull imaging, we're going to use an orbitomeatal line as a landmark. And we're going to use greater trochanter for hip imaging. Okay. Okay. So now we're going to talk about the use of positioning aids and immobilization devices. So what are positioning aids? So as we talked about it a little earlier, that the body has some natural curves which need to be, which need to be supported so that the movement of the patient is less. So for that we use positioning aids. So these aids, they include sponges, foam pads, sandbags, compression bands. So we use these types of cushions, these types of knee wedges, we use abdominal compression so that the patient is not moving more and we get a good quality image. And there are few immobilization devices also, which are, we use straps, splints, pediatric immobilizer, head clamps. So these immobilization devices especially used in, special age group people like pediatric people, elderly people, trauma cases. So that, because pediatrics, you can't explain a child not to move, right? So we need to use some kind of immobilization so that, it gets us a more clearer image, right? So prevention and control of patient motion. Okay, so this is the kind of immobilization device which we use for pediatric patients. And yes, okay, so now we finished the first part of our talk today, which was accuracy. Now we're going to talk a bit about radiation safety. So, if as far as X-rays are concerned, so what are X-rays? Can anybody define what are X-rays? Yes, please. Hmm.
Hello, sir. Good afternoon. My name is Aryan from Pune campus.
Good afternoon, Arjun.
So, X-rays are the ionizing radiations
Mm-hmm.
coming from the X-ray machine and X-ray beam.
Okay, thank you. Anyone else?
Yes. Good afternoon, sir. I'm
Good
Kaima.
afternoon.
X-rays are electromagnetic waves that are capable of removing electron from human body, damaging the DNA, and it is harmful for humans.
Perfect, perfect. Thank you so much.
So,
Anybody else? Yeah, I see a few answers in the chat as well. So X-rays are short wavelength and high penetration power. Okay. Okay. So as you guys said correctly, X-rays are a form of ionizing radiations which have sufficient energy to remove electrons from atoms in human tissues. So that is how we get an image. But when these ionizing radiations they interact with the cells, they can cause damage to our DNA and other cellular structures, which may lead to events like cell death, cell mutation, or abnormal cell growth. Okay. So, short term effects of these radiations include skin redness and tissue injuries, while long term effects include an increased risk of cancer. Right? Children and pregnant women are more sensitive to these radiations because children and pregnant women have more dividing cells. Children are growing and pregnant woman is growing a life inside of her. So they have more number of dividing cells inside. So that is why they are more sensitive to these radiation effects. Okay. So that is why since these radiations carry a potential risk, we have to use them very responsibly. Right. So for the responsible reuse, we have something known as ALARA principle. So what is ALARA principle? ALARA principle stands for as low as reasonably achieved, right? So we have to use these radiations as low as possible to get as accurate result as possible. So there are three main components of this principle. Okay, the first one is minimizing the exposure time. Next is maximizing distance from the radiation source. And the third is use of appropriate shielding when possible. Yeah. So radiographers, what they do is they need to select exposure parameters such as kilovoltage and milliamp seconds to optimize the dose. Okay. We need to avoid unnecessary repeat examinations. And how we can do that? We can do that because we can do that with proper positioning and techniques. And what ALARA does is ALARA engages a culture of safety, responsibility, and continuous monitoring of radiation use. Okay, so now we're going to talk about various protection methods. So first we're going to talk about protection methods for patients, then healthcare staff, then special patient groups. Okay. So patient protection is actually the primary responsibility for every radiographer. Okay, so before exposure, correct positioning and centering of the patient should be confirmed to avoid repeat imaging. Beam collimation must be applied to restrict radiation only to area of interest. Okay, appropriate shielding should be used for sensitive organs when indicated. So, for example, If you are doing an orthopantogram, the patient, we should give the lead apron to the patient, so that the vital parts or the other vital parts of the body are preserved. Okay, exposure factors such as kilowatts and milliamp seconds should be selected according to patient size, age, and clinical indication. And special dose reduction techniques should be applied to pediatric patients. Okay, so this was about the patients. Now, what about the healthcare staff? So, healthcare staffs, they should, because since they are more susceptible, because they have to be in the room, they have to do X-rays again and again. They are more susceptible for these exposures. So they get exposed very, very highly, right? So all staff should, use protective equipment such as lead aprons, thyroid sheets whenever necessary. They should always be behind protective barriers and control booths uh, when when screening the patient. Okay. So there are personalized dosimeter batches which should be worn. So what these batches do is these batches, they detect uh, the irradiation exposure to the staff, and they change their color. So when the certain color is achieved, that means that okay, this particular member of the staff has reached their maximum threshold of radiation exposure. So these dosimeters should be used normally and regularly. Okay. So now we're going to talk about radiation safety in special patient groups. So special patient groups include pregnant women, pediatrics, and trauma cases. In pregnant patients, first of all, we need to avoid radiographical screening as much as possible, right? If it is really necessary, then only we should go for it. And again, the dosage should be really controlled. Same case is with the pediatric patients, because they have higher dividing cells and longer life expectancy. They are highly sensitive to radiation. So low dose protocol, proper shielding, and strict justification must be followed. Okay. Trauma and critically ill patients require rapid imaging while maintaining maximum possible safety. So if there's a trauma case coming into your hospital and the patient is serious, you don't want to waste time on imaging. But on the same time, you will need an imaging to diagnose it. So your imaging should be very, very fast, right? Okay. So now we are done with the radiation part, and we move on to the last part of our talk today, which is image evaluation and quality assessment. So why do you think image evaluation is important? So we did the examination, we did the screening, we did the test. Now we have the image. So why do you think evaluating that image before sending it to the doctor or clinician is important? To know if the image is accurate and any artifacts in, okay, to prevent misdiagnosis. Okay. Anybody else? Yes. To check whether the image is taken properly or not. Okay. Okay. So basically we evaluate the image to see if the image is of a good quality, if we are able to see the point of interest properly or not. And just in just X-ray, we have to check apex and CP angle visible. Okay, that is nice. To check if the image is proper without artifacts or noise. Amazing. Okay. So what are the characteristics of a high quality image, right? So what do you think are characteristics of a high quality image? Anybody? So image should be visible of our organs and bones properly. Okay. Anyone else? Okay. So in a high quality image, first of all, the entire region of interest should be visible without unnecessary anatomical cutoff. Okay. The anatomical structures which are visible, they should be in their correct position without rotation or distortion. Okay. Image density and brightness should be appropriate, allowing visualization of both soft and tissue, both soft tissues and bony details. Okay. And the contrast should be sufficient to differentiate between structures of different distances. So, see, in this image, we can see the importance of optimum contrast, right? So, if the image is of a high contrast or a low contrast, we really can't make out what's going on. But if the patient has a good, if the image is of good quality and an optimum contrast, we can see that okay, we have something abnormal going on here. We have something abnormal going on here. Okay, so the contrast is really important. Okay, there should be no evidence of motion blur or double lines. Collimation should be appropriate, and correct anatomical side markers and patient identification details should be present. So as we can see in these images, okay, this one is really blurred. We can't really see the anatomy properly. Whereas in the last image, okay, it's very clear. We can see the anatomy properly. We can see the soft tissue and bones properly. So if we have to make a diagnosis over here, it's very easy for us to make a diagnosis. Okay, now we have two different images. Okay. Who can make out what is wrong with image 1 and what is right with image 2, which is very evident? Anybody wants to tell us something about both the images? First one is unclear. First one is very blurry. In image 1, this one.
Good afternoon, sir.
Good afternoon.
So, first image is blurred and second image is clear. So, in first image, the contrast level is low, and in second image, it is good. Even the positioning is good, alignment is good in second image. In first image, there is movement, so we can't diagnose it. Thank you.
Okay, perfect. Thank you so much. Okay, so as she said that, okay, this is blur, this is of low contrast. We can see anatomical cutoff over here. So we can't properly make out the pelvis over here. And so we have anatomical cutoff over here. The alignment is not proper, right? Here, so we can't even see anything over here. So yeah, this, of course, this image is way better to diagnose a patient than this one. So this is why image evaluation is really important when it comes to radiology. Okay, so we have a systemic method which we use for image evaluation, which is known as PECC method, right? So what does PECC stand for? PECC is position, exposure, collimation, and contrast, right? So in positioning, we assess the patient's alignment, centering, and anatomical coverage. In exposure, we evaluate the density of the image, the brightness, and the noise. In collimation, we verify the appropriate beam restriction and field size. Sorry. And in contrast and clarity, we assess the sharpness of the image, the contrast resolution, and absence of motion blur. Okay. So now that we saw what a high quality image and a low quality image looks like, and what wrong can happen with these, We're going to talk a little bit about common positioning errors first, and then we're going to move to common technical errors which can happen and their effects. So most common positioning errors which can happen in a radiograph is, first of all, the patient rotation. When the body is not aligned symmetrically, which leads to distorted anatomical relationship. Second one is incorrect centering, which results in partial visualization or complete omission of area of interest. The third one is anatomical cutoff, when the detector does not cover the required region, right? The fourth one comes as the wrong angulation of central X-ray, which causes elongation and short shortening of structures. And last but not the least is the improper detection placement, which may lead to magnification and image distortion. Okay, so these were the positional errors. Now, what about the technical errors which can occur in radiography? Okay, so technical errors can include overexposure, which results in dark images, underexposure, which results in noisy and grainy images. Okay, incorrect KVP, which affects the contrast and penetration of the image, and improper MAS selection, which influences the density and sharpness of the image. So as we can see in this particular picture, so this one is taken with 1 milliampere second, which is fairly clear. But as we increase the value of milliamp seconds, we see that image is getting darker and darker, and not properly readable till when we come to 4. So when we are on 1 milliampere, it's very bright, and the contrast is little bit on the higher side, or the sharpness and contrast a little bit on the lower side over here. With 2 milliamperes, yeah, that is a good image. We can appreciate some part, but again, we have a darker region over here. But 4 is, it's useless. Okay. Next error is grid cutoff. So what is grid cutoff? Grid cutoff occurs when a grid is misaligned, reducing image density. So we can have artifacts which are usually due to foreign objects on the patient's body, or there's some fault with equipment. Okay, so we need to check that these errors are not there. We need to try and avoid these technical errors from our side, so that images are of good quality. Okay, so now we'll talk a little bit about quality control. So, okay, another question for you guys is, what do you think a radiographer should do on his part to ensure that his machine and his equipment, or he himself, is giving out good quality radiographs? Calibration, okay. Regular check of machines, routine equipment care is necessary, okay. Anybody else? Routine checks on equipments, the routine checkup before patient use, okay. Okay, this all was about the equipment. What should radiographer do on his part to ensure that he is doing things properly? Maintain proper professionalism with patient, okay. Anybody else? Yes.
Proper positioning of the patient and proper exposure factors.
Okay.
The contrast,
Mhm.
the proper contrast
Mhm.
and use of grids to reduce the scan.
Okay. Thank you. Okay. So as we all know, quality control is really important, right? So quality control includes calibration of machines, assessment of image receptors, monitoring of exposure consistencies. Okay. And all this has to be done along with regular image audits, repeat analysis, and staff performance reviews so that each and every member of the staff has a certain, level of education maintained. And documentation of quality activities is really essential. Right. Okay. So I just said the documentation of all the activities are really essential. Why do you guys think that documentation is essential?
Documentation plays a very crucial role
Mm-hmm.
in like it is a role as a as evidence in court. It can play a
Mm-hmm.
role as of evidence for in court, and documentation includes MLC cases in which law and police, all of them are included.
Mm-hmm.
And yeah, documentation is important for that.
Okay. Okay. Anybody else? Thank you. Yes, please.
So I think documentation is important so that the workflow can flow smoothly,
Mm-hmm.
equipments and patients are handled safely. Like if we keep documentation of all the equipments in our lab, then we will know where the things are used or where they're kept, and all staff will be informed about it. And
Mm-hmm.
also documentations of patients, obviously it helps us to identify which patient is being diagnosed and what which patient is coming next, those things, and will also have that on log, so it will be of our future use as well. So I think that's why documentations are important.
Okay, that's a good answer. Thank you so much. Okay, great answers, guys. Amazing. Okay, so what all things documentation should include? So documentation should include name, age, registration number of the patient. Okay, they should each radiograph film should include date, time, and the anatomical side marker, right? When we are documenting, it is advised that we also document the exposure parameters and techniques used. And it should be, all the documentation work should be securely and stored properly so that if you want to refer it in future, they are readily available. So what happens is if the documentation is incomplete, they may lead to medical legal complications. So it's better to be safe than sorry. It's better to document everything so that you know if if in case there is any disputes or audits later, there is a legal protection for the staff, right? Okay. So now ethical principles in radiographic practice. So these are basic things that okay, the radiographer should be very kind, he should be professional, he should he should maintain patient confidentiality, he should not discriminate patients. Any errors or incidents on his part should be reported honestly and promptly. Any unnecessary or unjustified radiographic, examination should be avoided, all that stuff. Okay. Now we're going to talk about continuous professional development and lifelong learning. Why? Okay, last question, and I think this is the last slide. So last question from my side is why do you guys think that lifelong learning and continuous professional development is important for a radiographer? Yes, please.
Good afternoon, sir. I'm Fauziya speaking. Sir, we are working with the machines. So in radiography, radiography, there will be a advanced machine developing, so learning is important.
Okay. Thank you. Anybody else? To improve our work and continuous growth in the field, to enhance our skills, to get better, to keep in touch with advancements. Okay, perfect. So yeah, that is because as imaging is a very rapidly evolving field, so we want our radiographers to be to keep up with the technology and to be at their best. So for that there are many, we have various CPD courses, CME courses, workshops, seminars. They should attend that. There are online courses, professional journals, certificate programs which provide lifelong learning. And learning from feedback, audit, and peer review also enhances professional performance. Okay. That is all from my side. Thank you so much, everybody, for active participation and listening. I'll leave my contact details in the chat if there's anybody who wants to ask anything, any questions. And thank you so much from my side. You've been an amazing crowd. Thank you.
Thank you, Dr. Ishaan. Zakir this side. It was really a nice and interactive session with all the students. Hope all the students have enjoyed the session. And I thank you on behalf of all the organization committee and from organizations of university. And also thank you on behalf of TORG, the Operating Room Global, as you are also a member there in peer reviews and all that. And I thank you, CEU Professor, for this very nice initiative. And it was a very nice interactive session with all the students. Once we get any questions and all that, I'll revert back to you. Thank you so much. So thank you. It was very nice.
Thank you so much, Zakir sir, for having me ever. It was such an honor to be here. And thank you.
Thank you so much, students, and you can leave this meeting now. Okay. Thank you so much, everyone, for joining us.